Hi, I'm Dr. Art Bartolozzi, and I'd like to talk to you about kneecap pain, or as we call it, patellofemoral pain. The patella is a small bone on the front of your knee, called the kneecap, and it basically is a bad design. The stresses that go across the patella can be up to 6 times your body weight. So minor injuries can cause kneecap pain, falling on your knee can cause a kneecap pain, and the cartilage that's behind your kneecap is actually the thickest cartilage in your body. So when it gets injured, it's difficult to treat and it's not easy to replace. In fact, it's irreplaceable. So we have to be very careful about how we manage and how we address kneecap pain. Most people who have kneecap pain don't have damaged cartilage because there are a lot of structures around the knee that can hurt. There are ligaments and tendons and muscles. So most of kneecap pain can be related to irritation of the ligaments and tendons. There's a fat pad behind the knee that can be irritated. There are small attachments around the kneecap called the plica that can be irritated. So there are a number of processes that can occur that can cause kneecap pain. In fact, 60 to 70% of runners have kneecap pain at some point. Now, what's important to understand is that if you have kneecap pain, you shouldn't work through the pain if there's a damage. Well, how do you know if there's a damage? If you rest your knee and give it a substantial period of rest for 1 to 4 weeks and the pain doesn't improve, that's something that needs to be addressed. If you rest your knee and it gets better, then you know it's not serious. What is serious? It's serious when the knee catches, when it locks, and when it swells with every activity. Now, one of the things that I tell patients about kneecap pain is if you can imagine sitting with your knee bent for a long period of time, such as in a car ride or in the movie theater or on an airplane, your kneecap is under tremendous stress and it can't be moved. And so sitting there can generate up to 100 pounds of pressure on the knee for an extended period of time. So the best thing to do when you have kneecap pain is most of the time during the day when your knee hurts, keep the legs straight. If you work at a desk, keep your foot on a little stool so that you keep the pressure off the kneecap. And that's the easiest thing to start with. Now, what other things can be useful? Oftentimes there's a muscle imbalance around the knee, so physical therapy can be used to address the muscle imbalance, and we talk about the tracking of the kneecap. So if the kneecap doesn't track quite centrally, sometimes the muscles can be helpful there. It's very subtle, but it does help. Sometimes the kneecap can be taped, and the physical therapist understands that. Most often, the quadriceps muscle, which is the big muscle on the thigh, is tight. And as the quad gets tight, it puts more pressure on the kneecap. And so one of the easiest things we have to do, in addition to changing your posture and your activity, is to stretch the quadriceps muscle. And the physical therapist can easily show you how to do that. Medication is sometimes helpful. And if you've had kneecap pain, I'm sure you've tried medication. But most commonly we use anti-inflammatories such as Advil or Aleve, and a prescription level dose, which is slightly higher than the bottle recommended dose, sometimes helps. In rare cases, injection, and in even rarer cases, we do surgery. But surgery generally is not helpful. In advanced and severe cases, where the kneecap cartilage, this is depicted here, where the kneecap cartilage is worn down, arthroscopy can be performed to smoothen that surface. But that is not a very successful procedure because we basically remove cartilage and we don't replace it. So if the cartilage is falling off and fragments are being collected in the knee, sometimes a surgery like that helps. In very, very advanced cases, sometimes the kneecap has to be moved by tightening or loosening ligaments around the knee, or in the most advanced cases, cutting the bone and realigning and repositioning the kneecap. So it can go from a very simple process with activity modification to a very complex process of bone cutting surgery. My basic recommendation is to avoid surgery, if at all possible, on the kneecap, because there's an old saying that there's nothing we can't make worse with surgery, and oftentimes with a kneecap that happens.